Working for NHFML, the opportunities are there for anyone really to progress. Without having gone to university and so on and so forth, you could start doing a domestic job or an unskilled job, and when opportunities come up, as long as you put the work in, you'll be considered, and you can actually go quite far.
We have a very good team, very strong team. We have a good management team who are very fair. We encourage people to grow within their jobs. We encourage people to take up training opportunities, to develop themselves into other roles, and just generally improve themselves throughout.
Within the maintenance sides, we've got a wide variety of people from all kinds of backgrounds, and we use them skills to bring together to make the hospital function, basically. We've got people from mining industry, shipyards, technical side from media backgrounds, and everyone doesn't have the single answer, but together we do come up with the answers.
My role's just as important as every other staff member within the trust, whether it be estates and facilities, domestic, linen department, healthcare, staff, nurses. Everybody plays a big part in whatever job they do on a day-to-day basis.
For me, coming to work for NHFML provided the real opportunity to genuinely make a difference in the NHS. It's a big organisation, it's huge in this region, and it's fantastic to be a small part of that whole process. We're often the forgotten heroes, aren't we? We're the people who do all of the activity behind the scenes. But without us, the healthcare facilities simply couldn't function. We perform an absolutely critical role, and it doesn't matter what activity you do, everybody's role, everybody's contribution really does count.
Breakages, they are sorted within minutes sometimes, whereas if you had to ring a contractor in, you would have to again travel to the hospital to do that. So downtime of the machine costs money, so yeah, we're on the doorstep ready to do the job.
In terms of managing energy, if you look at the financial aspects, if we can save £100,000 off our energy bill, then that £100,000 trickles back down into the provision of healthcare. So that could pay for maybe a couple of nurses. Conversely, that could go towards new equipment. That saves lives. So it's very important that we spend as little on energy as we can.
The best thing of working in a hospital is that you're not just rewarding yourself because you know you've done something good, and you know that NHS is doing good for everybody else, but you also got to think of that you do need other departments. It's not just nursing departments. You've got to have a linen department to make sure that the hospital's running, because if you didn't have clean linen, the hospital wouldn't run.
So for me, genuinely, the best thing about working for NHFML is that sense of pride. You make a real difference to hospitals in your region, hospitals that your friends, your family end up using, and to be a small part of that process genuinely makes a real difference to you.
The camaraderie with the catering staff themselves is amazing. They're such a good team. Everyone's fighting the same cause, and we make sure we find a lot of time for our own morale.
Yeah, I suppose getting to this position, it is like being empowered, but being empowered to help people. That's my main goal throughout the whole thing, is to help people. Whether that's to help them through their career, help them in their departments with their problems, whatever way I can help. Build a team, and we can do anything.
And it's almost like a virtuous circle. Good health depends on a good environment, and that good environment is the external environment that our patients and our friends and colleagues live in. It's the internal environment which our colleagues and patients visit or work in, and without sustainability, those environments may not be as good as they are now.
Is the colleagues, the girls that I work with, we all get along, we work as a team. we all come up with new ideas. They might work, they might not work, but we try them, and just the communication, friendliness. I like a little family.
And we always have a heart on my sleeve, so if we can help somebody in any way, we do. Everybody's out there to help everybody. You've got a key role, and I just feel that if you can help in any patient or any colleague or management in any way whatsoever, you're playing a key part of your job, knowing that you're proud of what you've done.
I think one of the best things about my job, my role, I'm in a position where I can teach other staff new tricks. I get a lot of satisfaction from seeing the good work they do, and what we're producing here going up to the ward, see the satisfaction from the patients, and it just generally it gives you that buzz that you know what you're doing is right because you're getting the right results.
Coming into a hospital environment's totally different to anywhere else I've worked, but it's proven that using the skills of other people and learning from them, and then the support from the trust to put me through education to get me to this position nowadays proves that anybody can do it. If I can do it, anybody can actually do it. Whatever age you are, I was late in coming into the trust, so yeah, if I can do it, anybody can.